Joints can become damaged through a variety of different processes, and sometimes the damage doesn't heal properly. Because of that, the joints need to be replaced. And the commonest way that joints get damaged and need to be replaced is a process called osteoarthritis, which is linked to aging, so it is much more common in older people. So annually in England and Wales, we perform approximately 70,000 total hip replacements and 70,000 total knee replacements. A very small number of patients go on to get deep infection. So approximately 4 in 1,000 joint replacements become so badly infected that the operation needs to be redone. This can be run one out of 2 ways. The first is called a one-stage operation, and there all the infected tissue and the infected implants are taken out, and in the same operation new implants are put in. The more traditional way, which is done predominantly in this country, is a 2-stage operation, where we take everything out in one operation. We then treat the patient with antibiotics for about 3 months before putting in a new joint replacement at a second operation. Now that's how we've traditionally done it in this country, and it's found to be a safe and effective way to treat infection. Now some centres around the world have been doing 1-stage procedures, and this is becoming more popular. And initial studies do suggest that 1-stage may be just as effective as 2-stage at getting rid of infection. What we don't know overall is which is better from a patient perspective, and which is truly better at getting rid of infection. For this reason, the government has given us money to run a randomized controlled trial whereby patients will be allocated either to have a 1 or 2-stage operation, and then we will compare the 2 groups to see which one is better in the longer term. And we're currently recruiting for that trial.
In order to answer this really important question, we obviously need to collect information from our patients. Before we started the trial, we asked patients, what is the most important thing for you in terms of measuring how well you've done after your operation? And they told us it wasn't just about whether they recovered from the infection, but actually what their quality of life was like further down the line. So were they having pain, stiffness, and how could they carry out their normal daily activities after their operation? So this was the main focus for our trial, was patient-reported outcomes. So really asking patients how they feel throughout their recovery up to 18 months after their operation. So as this is a rare condition, we need to involve as many patients from all over the country as we can. We're hoping to get 148 patients involved in a trial at the moment at 12 different centres across England and Wales. And all of the surgeons at each of these centres are very experienced in treating patients, and they do revisions for hip infections at these centres. We're asking patients to complete questionnaires every 3 months for a total of 18 months. These are sometimes done on the phone and sometimes done in the post. We're also asking nurses at each of our centres to collect data from the patient's notes to find out some of the details around the surgery that they've had, so we get a real picture from the patient's perspective and from the healthcare perspective about exactly what these patients have been going through.
We're hoping to learn a number of things from this trial. Most important is which of these treatments is most effective, particularly from a patient point of view, at improving their lifestyle and getting rid of the infection. We're also trying to find out which is the most cost-effective way of treating it, both from a societal point of view and from the NHS point of view.